Dr. Kelly Wade, a clinical psychologist and postdoctoral researcher for the Cerebra network at the University of Birmingham. In this short video, I'll be discussing why pain is such an important factor to consider when thinking about the behaviour and well-being of people with severe intellectual disability and complex needs. We tend to think of physical pain as a universal human experience. We've all felt pain at some point, so it can be easy to assume that we can spot it in others. But pain is subjective. The only person who truly knows how much pain they're in is the person experiencing that pain. This is true of both brief, acute pain like a paper cut, and of more long-standing chronic pain like back pain or joint problems. Pain can have a real impact on people's mood and their behaviour. We can all relate, I think, to that experience of suffering through a day with a really bad headache. We might find that we have difficulty focusing or have a much lower tolerance for life's little frustrations. We may even find ourselves snapping at the people around us. For many of us in this kind of scenario, the answer might be as simple as taking some aspirin. However, for a lot of people with intellectual disability, letting those people around them know that they're in pain and might need a bit of extra support can be a real challenge. We generally rely on self-report when assessing pain. It's the gold standard for clinical assessment. We ask questions like, on a scale of 1 to 10, how much would you say it hurts? Or would you describe it more as a burning pain or a stabbing pain? But the abstract language used in these kind of assessments means that lots of people with intellectual disability might struggle to self-report, even if they use verbal communication normally. The assessment of pain is particularly important in the context of severe intellectual disability and complex needs for a number of reasons. One is that we know many of the genetic syndromes associated with intellectual disability are also associated with a range of painful physical health conditions. Things like gastric reflux, ear infection, respiratory issues, and dental problems are all more common for people with intellectual disability. Secondly, we know from decades of research that there is a link between pain and behaviours that others might find challenging. One particularly problematic link is the association between pain and self-injury. This is concerning not only because of the potential for permanent damage in cases of severe self-injury, but also because if pain goes untreated for an extended period of time, then over time those self-injurious behaviours become learned behaviours, and we may find that they continue long after that initial pain has resolved, becoming gradually more difficult to intervene with. In many cases, pain can be easily treated or managed, and we expect that with good pain management, we'll see an improvement in behaviours and, much more crucially, an improvement in quality of life. Really then, the important step is learning how to recognise pain in people with intellectual disabilities, even when they can't tell us about it themselves. When trying to assess pain, the things to look out for include distressed vocalisations. This is groaning, moaning, crying. You might notice a furrowed brow, or notice that somebody flinches, guards, or cradles the part of the body that hurts. However, there are also more subtle signs that are worth looking out for. Things like being particularly difficult to console, being more restless or more lethargic than usual, or changes to appetite and sleep. Whenever you notice a sudden or unexpected change in someone's behaviour, pain should be the first thing to assess and properly rule out before attempting any kind of behavioural intervention. If you suspect that an individual is in pain, the next step is to get them properly assessed by the appropriate healthcare professionals. In cases where there's a known genetic syndrome, it might be helpful to think about any physical health conditions that are commonly associated with that syndrome and start your assessment there. I hope this video has been helpful. If you'd like to find out more about pain or pain assessment, or about how to better support people with severe intellectual disability and complex needs, check out cerebra.org.uk and findresources.co.uk.